I wanted to make a quick video that runs through the three main steps of utilizing the Q-tip to open the contacts when taking a bite wing x-ray. So I have another video that you may have been provided that goes into a little bit of detail where it shows sort of how to line up the Q-tip accurately and talks a little bit more in detail of some of those techniques, but this is mostly just focusing on the three steps, the three-step process that you'll use when you're in the radiology lab. So the first step is you want to think of the three things that we're going to use. We're going to use the Q-tip, we're going to use our BID, this is my fake BID, my Starbucks mug, and you're going to have your XEP. And I didn't set this up fully because we don't necessarily need the bite block part. It's mostly the bar and the ring that I wanted you to pay attention to. And this is so that you can really think of the sequence, and hopefully the rationale of the sequence also kind of stands out and makes sense. So the first thing you're going to do with your patient is you're going to find the angulation that is the correct angulation that would go straight through their contact. So it's going to be different for everyone. We use the first and second maxillary premolars when we're taking a premolar shot, and you usually will use the Q-tip. You might have them open. You might even have to look under at their occlusal surface to make sure that you've lined this up correctly, because if you notice from that previous video, if you watch it, you want it to line in the exact same line as their contact, so that it goes straight through. It doesn't go off to the side, because then you'll clip parts of their tooth. You want to go straight through. The Q-tip is functioning as an extension of the primary beam, and you want that primary beam to go right in between their contacts. So we're going to pretend that we did that. We found our key contact teeth for our premolar shot. We are laying the Q-tip right across the occlusal plane at the right angle to open up the interproximal space. And now we're going to bring over our PID. We're going to bring over our PID, and we're going to make sure that the PID and the Q-tip are parallel. So we've brought that over, and usually we rest it about at the area of the ear. You can rest the PID, you can bring it over to about the ear. Once you see that these two things are parallel, like two train tracks. So you rest the PID over by the ear. You remind your patient not to move. You don't want to swivel your PID from right to left or up and down. It's okay to move the whole thing as a unit, but you don't want it swiveling. So we have it parallel with our Q-tip. We have it sitting and waiting over about at the ear. And then we're gonna, from this point, we're gonna take away our Q-tip because we've transferred that angle from the Q-tip to the PID. So we're safe, we still know our angle. So now we're gonna ask our patient to open, and we're gonna place the bite block in their mouth. And when they bite, maybe it looks like this. And I know this isn't necessarily the best angle, but this bar, the metal bar, and the PID are not parallel. So you have to situate the bar and the bite block in the patient's mouth to make it match your PID. And at the same time, it can be tricky, because at the same time you want to bring it anterior enough so you get the distal of the canine. And so there's a couple things to think about, but in the end, this bar and the PID should be parallel. And if they are, and you're in the right placement, then all you're going to do is drop this down in front of the bar. And at this point, these two lines should be parallel. And so those are your three steps. Get the Q-tip in the right angulation, match it up with your PID, and then match up your XEP and the bar with your PID, and then drop it into the ring so that you can take the shot. And cross your fingers that it all worked out and your contacts are open.